So let's begin with the next chapter of parasitology, and that's the trematodes. I hope you've already read the cystodes and coming to this chapter after that. So the trematodes are going to refer to as the flukes, and they're going to look extremely flat. So now what are the different members that we're going to discuss under it? Schistosoma, Paragonimus westermanni, Clonorchis, Opisthochus, Fasciola hepatica, and Fasciolopsis buscae. Not just these, some more, but these are going to be the main ones. And I just want to tell you that all of them are grouped in one category. So put all of them under one and put ye S wala schistosoma into separate category, because I'm going to tell you a set of rules which will help you all throughout this chapter. Remember, the infective form for all is going to be the Metacercaria larva. For all of them, it is going to be the Metacercaria larva. However, if you ask me what is it that is for schistosoma, so schistosoma is going to be an exception all throughout. Schistosoma says, no, I need something with S wala sound. So for me, the infective form is going to be the Cercaria larva. Point number one. Second, the mode of infection. For all of them, the mode of infection will be eating of the Metacercaria larva, whereas schistosoma says, no, I need something with S. So for schistosoma, it's going to be skin penetration. This was a recent exam question also. For all of them, the eggs that we have are going to be the operculated eggs. So I'm going to show you those eggs also side by side. For all of them, it's the operculated eggs, and I hope you remember you've done it in the cystodes. How do the operculated eggs look like? These are the eggs which have a lid. Do you remember the mnemonic? Lid is for protection, and you need protection against what? You need protection against STDs. So T for trematodes, of course. What were the other ones? S was for which cystode? S was for Spirometra, and D was for a cystode called Diphyllobothrium latum. So operculated egg that you're talking about, the egg with a lid, that is going to be the STD mnemonic that we had studied. So trematode family, but all trematodes except, now there's one trematode which has to have the exception always, and that is schistosoma. So schistosoma says, I'm not going to follow that. I need something with S, and that S is going to be the spinous eggs, right? So it's going to have eggs with spine. Do you want to see those? These are these eggs. Can you see a spine here and a spine here? So these spinous eggs are the ones which are going to be with SSS. But how do I differentiate which kind of spine? So look at this, guys. Where is the spine over here? This happens to be a terminal spine, right at the end. So if you see terminal spine, schistosoma hematobium is the only organism that has a T in it. So hematobium is going to show me the terminal spine. One part of it is done. Where do you see this one? What is this? This is the lateral spine on the side. So I have learned that schistosoma mansoni, man and soni, sleeping man, sota hua man, leta hua man. Okay, so laterally, leta hua, sota hua man, that is mansoni with a lateral spine. And here you can hardly see a spine. So what I refer to this as the rudimentary spine. This is the rudimentary spine, and please note, rudimentary spine is going to be seen with Japonicum. Japan is spineless. Or there's another mnemonic where people say Japanese people have round faces, they don't have sharp features, they have round faces, but I feel Japan spineless, वैसे भी याद कर सकते हो. So remember, terminal hematobium, lateral leta hua sota hua man, and rudimentary spine means there is Japan spineless. So coming back, all of them have operculated eggs, but schistosoma says I want a spinous egg. All of them are hermaphrodites, but schistosoma needs an S, so it says separate sexes. There is going to be a separate male and a female, that is worm, that is going to be present. So I hope till now it is clear. The drug of choice I'll come to right at the end, because here there is no exception of schistosoma. So till now remember, schistosoma says I need Cercaria larva as the infective form via skin penetration. My eggs are spinous and the separate sexes will be there. So now you will tell me that let's go on to their hosts also. Remember, for all of these, the definitive host is going to be all of us only. So that is going to be the human beings. Only in case of these fasciola वाला जो family है ना, तो इसमें fasciola में थोड़ा she वाला sound आ रहा है, fasciola, Fasciolopsis buscae, especially Fasciola hepatica can sometimes have the sheep also as the definitive host. That is why this is known as Fasciola for sheep and hepatica for liver. That is why this is known as the sheep liver fluke. That is the reason it is called as the sheep liver fluke. So all of them it is human. Only for this Fasciola, sometimes even for Fasciolopsis buscae, sheep can come. The first intermediate host for all of them is going to be the snail. So that is also common. So सबका definitive host is common, सबका first intermediate is common. What is going to differentiate? Second host is going to differentiate. So now schistosoma says that listen, my rule of life was I need an S and you have given me the S. After this, I don't want anything else in life. So schistosoma doesn't want a second intermediate host because schistosoma is happy with the human and the snail. S mil gaya, story khatam. What is this? Clonorchis and Opisthorchis. From today onwards, please remember for both of these, the second intermediate host, they're like cousin brothers, same chalte. So for both of them, the second intermediate host is fish, and from today onwards, you will learn these as clonorfish and Opisthorfish, because that is how you're going to learn them, and that is how you will remember their host, because human and snail you will remember for all, but clonorfish and Opisthorfish will tell you the second intermediate host. Let's come to Paragonimus westermani. So first and foremost, remember para ko you will learn it as cara. Cara means there's going to be crab and crayfish. The second intermediate host is going to be crab and crayfish. Also, so read carefully in the exam. Have they mentioned fish? So fish hoga to clonorfish or Opisthorfish. Have they mentioned crayfish? Cara wala fish. Cara is para. Cara is gonna be para. Also, if you note P for P, guys, this is gonna also affect the lungs. That is why, what is the other name for this? This is known as the pulmonary fluke. This is referred to as the pulmonary fluke because Paragonimus is going to go into the pulmonary system. Okay, what am I left with? These two fasciolas, Fasciola hepatica, Fasciolopsis buscae. So fasciola is fine, but remember, if you pick up the FA of both, you will get for both of them, FA means fresh aquatic vegetation. Fresh aquatic plants or vegetation is what you're gonna get, and usually this is the water chestnut. If you want to know a little bit more detail, usually this is the water chestnut plant. Now the story is only over. The chapter is almost done. It's beautiful. This table is golden, trust me. So schistosoma says human and snail, I got my S, I'm happy. I don't need a second intermediate host. Paragonimus says human, snail, to sab mein hai. Para says I want cara, crab, cray. Clonorchis or Opisthorchis, they need fish. Then Fasciola hepatica and Fasciolopsis buscae for their FA, they are gonna need the fresh aquatic vegetation like water chestnut. So this is also done. I think now we can go into details, know everyone's name, know everything about it. So let's start with schistosoma, which is known as the blood fluke, and by now you know schistosoma hematobium mansoni japonicum. You know all the S's about it. You know all the eggs about it. Life is going to be so simple. You are going to finish this in 5 or 10 minutes. So look at this. This is how the adult worm. How are you so sure that this is schistosoma ka adult worm? Because you can see a separate male and a separate female, and if you're seeing separate sexes, it has to be a schistosoma only. What do I see? I can see 2 suckers over here. So yes, there are 2 suckers, and just behind the sucker, can you see there is a canal, gynecophoric canal, that is beginning. So if you look a little carefully, just before this, you will see a gynecophoric canal, and what is held on by the gynecophoric canal? You will see, acha ye big wala jo hai, you can see this is the male, and just behind the gynecophoric canal, it has held on to the female. So basically, that is what you need to know. That just behind, that is the only part of this diagram that you have to know. So just behind the gynecophoric मतलब gyne को hold on करना है, gyne को मतलब female. Just behind the gynecophoric canal, the female is held, and that is what is the identification point of schistosoma. Okay, this was the adult worm, but tell me one thing. For schistosoma, was it infective form क्या है? Cercaria larva or metacercaria larva? Infective form, S wala. Cercaria larva. How do you identify this in the exam? Infective form for schistosoma is Cercaria larva, and you identified by the forked tail. You identified by this tail. There is no other form which is going to have a forked tail. Suckers to chalo sab mein hai, but this forked tail is very, very important. So now if I show you this life cycle, you will realize that firstly, how will you pick up in the exam that this is the life cycle of trematode family? Human, snail, human, snail. So here you have a human and here you have a snail. So trematode family to pakka hai. And after that, you don't have any other second intermediate host. So if you're only dealing with human and you're only dealing with snail, nothing else, this means it is a case of schistosoma. Okay, now let's see what are the S's that you had studied, guys. What is the infective form? Can you see the forked tail wala? The infective form is going to be the Cercaria larva. Okay, how is it coming? S says, is it coming by eating or by skin? So you will say, obviously this is going to penetrate the skin, so there is going to be skin penetration. After that, male female separate. Yes, I can see the separate sexes also going on over here. After that, once the male and female will mate, I can see the eggs being laid down. Guys, how are the eggs? Look at the eggs. The eggs are having a spine. If the eggs are having a spine, this means these are spinous eggs. Matlab again, this is schistosoma. Okay, after this, maybe you don't know the rest of the life cycle. Yahan tak to you knew. Cercaria larva with skin penetration. Cercaria with skin, with separate sexes, with spinous eggs. Now after that, what happens? In every trematode cycle, from the egg, you have some larvae that are formed, and that is known as MCRC. Pehle to please learn it once and for all. What is MCRC? Because you will see these random words written. Can you see Miracidia written? Then can you see cysts written over here? Then you will have something called radia, cercaria, metacercaria. Aisa kuch likha hoga. So you will keep getting confused. Once and for all, learn it. What is MCRC? So M stands for Miracidia. The first thing formed is Miracidia. Then C for cysts are formed. Then we have radia which is formed. Then there is a Cercaria larva that is formed, and after MCRC you will like to go back to the M, but that M is not going to be Miracidia, that M is going to be the Metacercaria larva. The M is going to be the Metacercaria larva. So MCRCM, MCRC, everyone mug it up, MCRC. But when I'm dealing with schistosoma, tell me, is Metacercaria larva the infective form or Cercaria? So you will say, ma'am, Cercaria hai, to Metacercaria to hoga hi nahi. There is nothing known as a Metacercaria larva. Secondly, there is one more form that is not there, and that is radia. Everyone please note that in the MCRC, only for schistosoma, baki har jagah MCRCM, MCRCM, repeat, MCRCM. Every life cycle of trematode will go that way. But when I'm talking about the schistosoma, the radia is not there, and the Metacercaria to cannot be there because Cercaria has to be the infective form. S I have to listen to. So can I say, all in all, MCC, सिर्फ CCC, वो SSS वाला sound वाला चीजें you will keep, and that is what is the schistosoma. And you can, if you feel only MCC, yes, I can see, ma'am, this was the egg. From the egg, the first thing you came out was Miracidia that went into this snail, as I can see. After that Miracidia, the cyst came out, and सीधा उसके बाद Cercaria larva बना. R is not there, radia is not there, Metacercaria larva not there. So like I said, only MCC will be there. That is what is schistosoma. Sorted with this life cycle, because now obviously you want to know which schistosoma, ma'am. Manzoni, Japonicum, or you're talking about what? Because if you look carefully, they have given you ABC. And they have labeled ABC. They have made schistosoma hematobium here in the urinary bladder. They have made Japonicum over here in the small intestine, Manzoni in the large intestine. So how do I differentiate between these and what do they cause? Please remember, schistosoma hematobium is going to cause hematuria. Okay, it is going to result in hematuria. Whenever something results in hematuria, means it is going into the urinary bladder, means the cancer that it causes is squamous cell carcinoma more commonly than transitional cell carcinoma. So all its problem is going to be in the urinary bladder. Remember, hematobium causes hematuria, and which cancers? Urinary bladder, of course. But remember, S for S. Schistosoma means squamous cell carcinoma is more common than transitional. So your previous year question is, schistosoma hematobium causes SCC, TCC, both. It causes both, but commonly S for S. Again, S has to be there. So where do you think it's going to reside? Which venous plexus? If it has to go and hit the bladder, it is going to reside in, obviously, the pelvic and vesical venous plexus. Pelvic and vesical means, obviously, bladder wala plexus. Now coming to schistosoma Manzoni Japonicum. First question is, which is going to be ileocecum, small intestine? Which is going to be large intestine? So simple, small intestine I and J come together. Japonicum goes in ileum. Japonicum is going to go in ileum, ileocecal region. That means that is the superior mesenteric venous plexus that is going to go into the ileocecal region. So obviously Manzoni will go into the large intestine, the sigmoidorectal, and that will be by the inferior mesenteric venous plexus. So as simple as that, ileocecum may we are going to have the schistosoma japonicum. But what do they do between schistosoma manzoni and japonicum? What do they actually do? They result in swimmer's itch. Swimmer's itch matlab, and japonicum also is going to result in a more severe form of swimmer's itch. But what is that swimmer's itch? Because this is coming through the skin, na? It's coming swimming through the skin. So wherever it will come or penetrate over there, there's going to be a lot of itching. That could be the neck or the shoulder or the hand, wherever it's entering from, there's going to be a lot of itching. That is going to be seen with manzoni and japonicum, but more severe with japonicum. And let me tell you, this japonicum is also going to result in genital schistosomiasis, which is a previous year question. It is also going to result in CNS schistosomiasis. So everything severe is coming up. So remember, japonicum pe genital, and also the brain, CNS, because all severe things are happening over here. Both of these are previous year questions. Okay, moving on further. So Japan is coming out to be quite deadly. Japan wala kafi dangerous wala lag raha hai, right? So now what is this entire disease known as? Whenever schistosoma causes a disease, that is known as schistosomiasis, or it is also known as bilharziasis. This is also another fancy name that you have. So hota kya hai? What is this schistosomiasis? What is the swimmer's itch? And also in acute schistosomiasis, there is something known as Katayama-like fever. So patient has basically a serum sickness like of an illness. Fever hota hai because starting hai, acute phase hai. But in chronic condition, anything chronic will result in fibrosis and granuloma. If I go to my basic pathology part, general path mein dekho, chronic inflammation mein kya tha? Granuloma tha, healing. So granuloma hoga, healing hoga. Healing means fibrosis. So chronic schistosomiasis will result in granuloma formation and pipe stem fibrosis. I have written periportal, matlab this is gonna occur in the liver. This is pipe stem fibrosis. So what can you see? All this brown color must be the normal liver. And what I see additionally along with these white bands, so these white bands are referred to as the pipe stem fibrosis. That is the pipe stem fibrosis. So repeating, in acute you see Katayama-like fever, lots of fancy name, bilharziasis, or we have Katayama-like fever, and chronic mein pipe stem fibrosis. Now you tell me how are you going to do the diagnosis? I think that much you know, but before I come down to that, I think one part of it that I want to definitely mark to you people is schistosoma intercalatum, which no one studies about. Everything is the same. You will say that ma'am, schistosoma intercalatum, spinous hota hai, Cercaria larva, separate sexes, yeah, all SSS, snail, everything SSS. But remember, intercalatum has lots of T's, na? So this also has what kind of an egg? It also has a terminal spine wala egg. Which other one had terminal spine? Schistosoma hematobium, that also had a T, so that also had terminal. Intercalatum also has T, that also has terminal. This is the one that can be acid fast at times, and this is not something we see in our country. It is more commonly seen in Africa. So quickly telling you what was the diagnostic ability. You know, for the diagnosis you're going to look at these, and now you can kind of analyze. Hematobium, because hematuria, urinary bladder hai, so you will see this thing in the urine sample maybe. And these two, which are small intestine, large intestine, these eggs you will see in the stool sample. Common sense lagana. So now if I give you that life cycle one more time in your life, and I say that if the examiner only gives this egg, if the examiner only gives this egg in the exam and says this is the egg that has come out in the urine, you will say, oh, ye to terminal spine hai, and urinary bladder, ye hematuria hoga, this must be hematobium. So he can not only give you this life cycle, depending on the egg, he can ask you which schistosoma you dealing with. Let's move further. Treatment I'll take for all in the end. Let's go to the next one, that is Paragonimus westermani. As I told you, P for P. So sabse pehle, Paragonimus westermani is going to be the pulmonary fluke. So lung fluke, pulmonary fluke. Paragonimus westermani, mani matlab Manipur mein it is endemic. Repeating, Paragonimus for pulmonary, westermani is going to be Manipur endemic, and of course it's going to show you pulmonary symptoms, which means patient is going to have cough, patient is going to have sputum. But what is very interesting is, by looking at the sputum only, I can kind of guess, because the sputum has golden flecks. Sputum sample will have golden color dots. Why? Because those are the eggs of Paragonimus westermani. Kaun sa egg? अरे मैम all trematodes का egg you have told me, अब schistosoma खत्म, SSS is done, come to all the others, all of them have operculated eggs. So this is how it's going to look like. It's going to look like an egg with a lid. It's going to look like an egg with a lid over here. So of course we are dealing with operculated egg, and can you see the color of it? It's so nicely golden brown. So can you see how that golden brown color is going to come up to the sputum also? That is what you see in Paragonimus westermani. But pulmonary is not the only thing. Of course, extrapulmonary symptoms are there. Of course, there is abdominal involvement which occurs in all. वो stool sample diarrhea वाला तो सब में हो रहा है, तो इसमें भी होगा. But P for pulmonary. So now if I give you a life cycle, first thing, what do you see? Over here, I very well see a human, and then I see a snail. I need to find the snail over here. Okay, there is a snail written over here. But the story doesn't end. I see a chota sa weird organism which is written as a crustacean. Crustacean means this is crayfish. So now just tell me guys, if you have a human being out here, along with the human being you have a snail that is there, and along with that you have crayfish. Of course, cray, cara, this means you are dealing with Paragonimus. If you still believe that nahi confusion ho raha hai, then what will you search? You will search for lung involvement. Have they shown me the lung involvement? Yes, there is an arrow that is going into the lungs. Of course, I can see that. So how does this happen? See, what will you do? What did you do? You consumed some fish. So what am I saying? You consumed, because now get over that schistosoma ka hangover. SSS bhul jao. Come to the normal things. Okay, so the mode of infection is going to be ingestion. And which larva? Now everywhere it is going to be no S. Now it's going to be the metacercaria larva that is going to come. So metacercaria larva comes into our body by ingestion. Ingestion of what? One of these fish. Okay, when it comes into the body, of course, it is going to go and adults banenge. Are they going to be separate sexes or hermaphrodites? Now they are all going to be hermaphrodites, okay? So now they are going to be same, male, female, same. So hermaphrodite bana. And these are going to be, forming male, female, single. Everything is present in a single worm, and an adult worm is formed. So they are going to exist in the duodenum. They are going to exist in the duodenum. Fine. Apart from that, they can also show you involvement of the lungs. This means the person can even, look at this, the person can even cough out the eggs. The person can even shit out the eggs, right? The person can cough out the eggs, and the person can shit out the eggs. So you're going to see eggs which are present in the sputum also, and you're going to see eggs which are present in the stool as well. And after the eggs come out, do we know one cycle? Do we know that MCRCM cycle? Miracidia, cyst, redia, cercaria larva, metacercaria larva. Same thing, MCRC chalega, and finally metacercaria larva is going to infect what? So you can see that the Miracidia was here, then MCRC and metacercaria coming back to us. How simple. Itna detail mein you will never have to know it in the exam only. You will anyway look at the human and the snail and the crayfish and know Paragonimus, Paragonimus. Let's move forward. We are now going to, lung is done. Now we move on to the next one, which is going to be the liver flukes. What all do we have? Although I had made you familiar with only Clonorchis and Opisthochus, maybe Fasciola hepatica, but now we have more. We have Fasciola gigantica also. So every one of them has a different name. Please note, C for C, that is Clonorchis, is known as which liver fluke? Chinese liver fluke. Then we have two Opisthochus, Opisthochus viverrini, Opisthochus felinius. Okay, out of these, please remember that this feline refers to cats, na? So this is going to be the cat liver fluke, and the one that is left, that is viverrini, that is going to be Southeast Asian liver fluke. You don't even learn the name, that's good enough, not needed. Then Fasciola, I just told you Fasciola had that she and liver wala sound, sheep and liver, that is the sheep liver fluke. And what is Fasciola gigantica? Obviously, it is the giant liver fluke that you have. So simple na, Clonorchis, C for C, Chinese. Opisthochus felinius is going to be the one with the cat. Fasciola hepatica, sheep liver fluke, and gigantica, giant liver fluke. Out of these, definitely, I'll show you the life cycle in तीनों में से किसी एक का ना, because you know that out of Clonorchis and Opisthochus, one thing was common, fish, Clonorfish, Opisthofish. So I will show you Clonorchis, for example. As I said, Clonorchis sinensis, C for C, it's the Chinese liver fluke, and this looks like a spatula. You can very well see this. It is looking something like a Spatula, it has a narrow end and it has a broad end over here, right? So spatula jaisa dikhega, and eggs are all of them are going to be operculated, ma'am. This much I know by now. Full family is operculated, only schistosoma was spinous. Look at their life cycle, so simple. I can see a human being over here. Apart from human being, I can see a snail over here. So I know this is definitely trematode family. And along with that trematode family, I see a fish. So when you see a life cycle which is going to be human, snail and fish, you know you're either talking about clonor fish or opisthor fish. And to confirm that, because they were liver flukes, because they are liver flukes, examiner will have to give you some kind of history to do with the liver or the bile duct. That will be your extra hint. That will give you more confidence that, yeah, not only my hosts are fitting in very well, but because liver tha, so I can see some bile duct involvement. So what exactly does it cause in the bile duct? Remember C for C. Remember it causes two things. C for cholangitis. So bile duct involvement, and the cancer that it causes is cholangiocarcinoma. Cholangiocarcinoma. So repeating, clonorchis causes cholangitis and cholangiocarcinoma. In fact, I think we can make a table over here, because right now I've told you 2-3 parasites and all of them are causing some kind of cancer, but I've taught you the same in neoplasia chapter of pathology also. Go to schistosoma. Schistosoma, I had told you that schistosoma hematobium causes S for S, squamous cell carcinoma more commonly than transitional cell carcinoma bladder. And C for clonorchis. Clonorchis is gonna cause C for C, that is which cancer? Cholangiocarcinoma. I hope everyone's okay. So C for C, S for S, S for S and C for C is how you're going to remember. Coming back, the story is not over. Okay, it is going in the bile duct, and okay again, story is the same. What do you think? Up tell me, clonor fish, the hosts are done. What is going to be the mode of infection? It's going to be ingestion. Which larva? Metacercaria larva. How are the worms going to be? They are going to be hermaphrodites. How are the eggs going to be? The usual eggs, operculated eggs. What is the life cycle after that going to be? See, dekho ho raha hai MCRC. So MCRCM, that is Miracidia, cyst, Redia, Cercaria, Metacercaria, and Metacercaria via the fish is gonna come into us. How simple is that? So now the liver flukes are also done, but if you go back, this was only about the clonorchis or pisthorchis wala family. Hai na? We are not done with this fasciola wala family, because fasciola hepatica is also a liver fluke, and you know fasciola, the host is gonna change. So here you come to fasciola hepatica. As I said, FA for fasci for sheep, hepatica for liver, and FA for fresh aquatic plants. This also looks like a flat leaf. This fasciola also looks very, very flat, and this is exactly what you're gonna see in it. So please remember, because I'm talking about fasciola hepatica, hepatica matlab liver, so they are also gonna show you all liver related things. That is gonna be bile duct obstruction hoga, liver matlab right upper quadrant pain hoga, jaundice of course in liver is gonna be there. All that is okay. Do you think they're ever gonna ask you that fasciola hepatica causes jaundice? Even a school kid will be able to guess that. They will ask you this: which of the following are associated with halzoin? So firstly, what is halzoin? It is a kind of laryngeal edema. So what I have learned is fasciola hepatica mein there is going to be halzoin, and halzoin is like hafna, breath, someone is short of breath. Why is someone short of breath? Because someone is suffocated. So remember, hepatica mein there is halzoin, and halzoin mein because of laryngeal edema the person is having suffocation. So halzoin mein hafna with hepatica. ठीक है, halzoin is hafna with hepatica, fasciola hepatica. Come on, the egg for everything is going to be operculated, so why make a deal about it? Everywhere you are going to see a lid, it's the same. The only difference is that what are going to be the host. The definitive host is always the man, ma'am. The first intermediate host is always the snail. Over here only the second intermediate host will change, and that is fresh aquatic vegetation. Perfect. Now we are done with this. Now we go to the last part. What about the intestinal trematodes? Intestinal trematodes, we look at this Fasciolopsis buscae. So Fasciolopsis buscae is the giant intestinal fluke. Then we have, if you can learn their names, heterophyte, you have metagonimals, you have echinostoma, ileocanum. Ileocanum will tell you obviously ileo matlab ileum, intestine, and gastrodiscoides hominis. Now the only thing that I want all of you to notice is everything was small intestine. Everything was small intestine. Only gastrodiscoides hominis is the one that is going to involve the large intestine. Rest, all of these, whatever will be written in the exam, that is going to go towards small intestine. So just learn one, that out of all the intestinal trematodes, I know that gastrodiscoides hominis is going to take home in the biggest home. It has selected the biggest home for itself, that is the large intestine. Rest all of them are going to be in the small intestine. And I think about Fasciolopsis buscae, I have anyway told you. Ab dekho, intestinal hai, to this is to common sense only, na, that it is going to show you abdominal pain, diarrhea, malabsorption. That is understood. And I have already told you all of them are going to be small intestine. Sirf gastrodiscoides hominis was keeping a big home. Everyone wants a big home. So gastrodiscoides hominis ne naam rakha and selected the big home. Rest all of them are going to go into the small intestine and have intestinal involvement. But you will now tell me the host. Definitive host for everything will always be the man. The first intermediate host will always be the snail. What is the second intermediate host? The second intermediate host is again FA, that is fresh aquatic vegetation. So now be very careful. Going all the way back, because your chapter is done, can you believe it? Going all the way back, if they give you Fasciola hepatica, liver wala, ya Fasciolopsis buscae, which is intestinal wala, you just need to know that both of them will have human, both of them will have snail, and both of them will have fresh aquatic plants. How will you differentiate? You will zoom into the life cycle and see liver ka involvement hai, to mark Fasciola hepatica. Intestine ka involvement hai, to mark Fasciolopsis buscae. Okay? And guys, coming all the way back to this, I think now you can easily tell me all their names also. Schistosoma was to do with the blood fluke, I hope you remember. Then Paragonimus, I told you P for pulmonary, so this is the lung fluke. I think these are very obvious, these three in front of you. Clonorchis, C for C, Chinese, these three are liver flukes. So C for C, Clonorchis was Chinese liver fluke. Opisthochus felinius, of course you know it is the cat liver fluke that we have. Then Fasciola hepatica was sheep and liver, so that was the sheep liver fluke. And finally, coming to the last one, that is the Fasciolopsis buscae, I for intestine, that is the intestinal fluke, small intestine. Finally, coming to your rules. All your rules are done, only the treatment is left. The treatment for all of them is going to be praziquantel. The treatment for all of them is praziquantel, but guys, here the exception is not schistosoma. Here the exception is Fasciola hepatica, which does not show a good response to praziquantel. So that is treated with, that is going to be treated with triclabendazole. That is treated with triclabendazole. Okay, so only this separate thing you all have to learn. Otherwise, sabka exception was schistosoma, but the treatment is different, right? Okay, let's move forward. Let's go on and discuss few questions, because then we'll be able to get thoda confidence. Let's start. The first is my favorite. You have to find out from the life cycle which of them is wrongly matched. Can you tell me one by one? Clonorchis. See, firstly, you'll say, ma'am, pura family to trematodes hai. Man, snail, man, snail, man, snail, man, snail. Har jagah ye to theek likha hai. Let me read forward after it. Clonorchis should have fish in it, but they have written crab. So ye to wrong hai. Okay. Paragonimus should have cara, some crayfish or crab. Sirf fish is written? No, they should have written crayfish preferably. So abhi ke liye I'll consider it wrong. Then I talk about Fasciola hepatica. Again, Fasciola hepatica can have sheep also, and A for aquatic plants. Ye theek lag raha hai. Fasciolopsis buscae can FA aquatic plants. Theek lag raha hai. Schistosoma needed only S. Once the snail come, it say that don't need anything else in life. So this is also wrong. So which are the wrong ones as of now? 1, 2 and 5 I believe are the wrong ones. And yes, I have an option like that. So over here, yes, I will take that as the answer. Let's pick up the next one. Which of the following has separate sexes? Now this is never going to go wrong. S for S, separate sexes, schistosoma. Operculated eggs are not produced by. Operculated eggs were produced by STD. Spirometra options mein nahi hai. Dilatum options mein hai. All the trematodes but not schistosoma. So this is a trematode, this is a trematode, but schistosoma is going to have spinous eggs. We all know it. So that is the answer over here. Next one, the infective form of man in case of schistosoma infection. S wala, Serratia larva. Serratia larva is your answer. Redia are not present in the cycle of, again, Redia were also not present in the cycle of schistosoma. Everything is going in schistosoma as an answer. Which of the following localizes in the veins draining the ileocecal region? I के साथ कौन सा? Schistosoma mansoni, hematobium या japonicum? We had studied schistosoma, japonicum is going to be the answer. Let's move on to the next question. Here you go, CNS schistosomiasis. This is one question. CNS schistosomiasis किसके साथ दिखेगा? Another question is that, first we'll answer this, CNS. So another question that can come is genital schistosomiasis will be seen with whom? So all of these were the more severe wala. Severe wala matlab we were dealing with, yes, japonicum. Yes, the question that I had shown you, terminal spinous eggs, terminal, T wala, ma'am, look for the T wala, hematobium. Schistosoma, hematobium is going to show me the terminal spines. Okay, last question that we have. A man few months after returning from a trip to Malaysia complains of pain abdomen, jaundice with raised liver enzymes and hyperbilirubinemia. Liver and bile duct though has been clearly involved. What is the most likely cause? Which out of these is a bile duct wala cheese? We all know clonorchis, cholangitis. Clonorchis and cholangitis are going very well, so that becomes the answer. That was not the last question. We have one more question with us. There's a 35-year-old man who presents to the OPD with productive sputum since 5 days. So lung involvement is mentioned. Productive sputum in our country, I think of TB, but sputum for AFB is negative. TB nahi hai. He gives a history of recent visit to China and consumption of crab pickle, cara. See, pulmonary involvement hai. Maybe it is paragonymous, and para is because of something to do with cara, crab, crayfish, that is also there. So the clear-cut answer over here is paragonymous. I hope everyone sorted with this chapter also.